Garage time, ladies and gentlemen. Working on the front of the hip. Hip flexor, one of the tightest areas on your body because you sit way too much. I'm already up in the position using one of my chairs to get there. So I've been hanging out here for 2 minutes. That's how long we're going to do our stretches for. So let's go over this one today. Hip flexor, front of the hip, super tight. When they're tight, pulls you into that anterior pelvic tilt. We've already talked about that. So if you're following along for low back pain, this is the newest addition to your treatment program. Or if you're dealing with something different, knee pain, possibly ankle pain, or actual hip pain, this may be a standalone stretch that you're going to use to help open up into some hip extension. So we're going to go 3 versions today. We're going to start with the easiest, using a chair. I'm going to bring it down, so I'm going to be a little bit of a headless horseman while I explain this one, but I want you to see what's going on with the hips and knees and stuff. So foot goes back up on the chair like this. Knee drives as close to the back of the chair as possible. You'll find the closer you get to the chair, the more stretch you get. So if you're super tight, you may be off of the front. Butt comes back towards your heel, and we just start bending the opposite knee forward, driving the hip that's stretching forward, squeeze the abs, hanging out in this position, increasing the stretch and the tension every time we feel that tension dissipate. Again, 2 minutes. That's how long we're going to hold this per side, and that's the hip flexor stretch, phase 1. Now, as you become more flexible, you're going to want to increase this. So we're going to come down to the floor. Phase 2, throwing the knee right into the corner of the wall. Foot up behind us. Opposite leg up into a lunge. And we're up tall, core engaged, nice and straight. If you can't get up into this nice tall position, move the knee away from the floor, wall as far as needed until you can be up nice and tall, abs engaged. So that's phase 2. Phase 3, going to give you the most bang for your buck. We're going to use a band to create some hip mobilization, some distraction in the front of the hip, as well as stretching the hip flexor. Foot goes through the band, comes up nice and high into the hip. Get that foot back up on the wall. Back up into our lunge position. Beware of wearing tight pants for this one. I've split a few. Band is pulling away, distracting the hip into the front, abs engaged, butt back to the heel, up tall. 2 minutes per side. That's your hip flexor stretch. I recommend doing some soft tissue on the front of the hip before you do your stretching, or you can always just use this as a great standalone if you're dealing with low back, hip, knee, or even ankle pain. That's it for this one.